Dr. Chatree reveals more details confirming Bangkok Hospital's outstanding operations and employee management, as well as the cutting-edge technological proficiency it provides.
Okay, and how it surprises me that many international patients are willing to fly all the way here to buy the premium quality that the Thai hospitals has to offer. So how do you get your message across to these, your target groups?
Actually it's word of mouth.
Mostly word of mouth.
Right. And then we add on, as I mentioned to you, that 360-degree referral system. We have our agent in here and in each country to make sure the coordination of patient referral from home to here, go back home. We call door to door and back to door. It's very smooth. Okay. And that's the reason why they all like to come here.
Okay, and what about the quality and assurance? You mentioned about the JCI. Can you elaborate more on that?
Yes, we are very strict. My background, myself, 21 in the US, I was working on quality and patient safety.
Yes.
So they hired me here to make sure we set up the same standard here. So we are very, very strict on patient safety and quality of patient care. So that's why we have chosen JCI, because Joint Commission International really strictly focus on patient quality and safety, and we tracer, meaning we check every week on all 11 hospitals that pass JCI, and we have a corporate team that go around and look around, make sure that they never let their guards down.
Okay. Do patients really look for that kind of certification?
Yes.
Before they choose?
Right. International patient, before they come here, is almost a leap of faith.
Okay.
So you have to make sure they come here. They get quality and they're safe for their life. They do. Unless they have been here before, they don't have no other way for them to make decision unless they see that certificate. But after they touch our care already, I think after that it's word of mouth. They come back without checking that. But the first time is very important.
Okay. So what about, we've talked about the patients, and now let's look at from the practitioners themselves. How about their movement in this AEC environment? The mobility of the workers will be more flexible.
Yes.
So what about the medical doctors and nurses? How would you see from that?
Just on the level of our company, we have been doing a lots of management to make sure all doctors, nurses, all service people, they're all happy with our hospital in the network, all 29 hospitals. We call it pooling effect. Pooling effect. We have been creating that 2 years ago, and we're going to keep doing it until we pass year 2015, including their pay, training. They are happy. They're proud to be here because of quality. They have their career path for them.
Okay.
They know what's going to happen in the future. We call stay and strive. All
stay and strive.
Yes, they want to say something. They want to stay and they want to strive to grow in our organization. And we call employee engagement to check all those.
Okay, how does that work?
Yeah, we will check them once a year. All kinds of questions to make. There are 21 questions to check for their engagement, how much they want to say about.
Okay, like a survey.
Right, a survey, and the score, the average score is around 58%. We have made that. Some starting not so good and some very good. We keep doing that to make sure that we have pooling factor for our people. So whenever AEC opens, we want to have the pooling effect. We don't want to lose our employees. Thailand as a whole, we are not sure, but in our company, we have been working very hard to have the pooling effect.
Okay, talking about the pooling effect, just now, how much are we talking about? Do we expect to see Singaporean doctors or nurses even more in 2015 and beyond? and probably Thai medical practitioners go abroad to Cambodia or Vietnam. Is that what you're saying?
Yes, because they can, supposedly, I'm not sure, and I still confirm that this can be very slow.
Okay.
Supposedly, they can go practice anywhere in ASEAN countries.
Yes.
We would love to see people come in, doctors come in more than doctors going out in the future in our country, and especially for our own company. Right now, we start seeing pull effect from hospital outside of our network already.
All right.
And lots of doctors abroad want to come work here. There's still lots of barrier. I think when we lift that, I think lots of doctors want to come and live in Thailand.
Okay.
Even though the income can be less than staying in Singapore, but the cost of living is much less, and then things are much more pleasant. This is personal feeling. Maybe it's not scientific.
Okay. And what about the push factors? Are there any negativity, by having the AEC in 2015? Would you be having a lot of people from Thailand going out to other countries?
I do not see much of push factors in the country except for environment, like I mentioned to you, discipline of people, socio-economy,
Yes.
which I don't think that's a main factor. I am afraid of pulling factor is stronger than the other country. Like payment for professionals is much higher in Singapore and Malaysia.
All right.
However, with maybe it could be neutralized by a living condition, meaning not that they're bad, they're worse than us, but living condition in more of the Thai hospitality environment, something like that, could neutralize it. Nurses, we do not feel we worry much about nurses because the Philippines has been providing nurses for all over the world. They have so many nurse graduates yearly that it's more than any. They have been feeding to all the countries.
Of course.
So if we can have nursing come here freely, we can easily take it from other countries.
Okay.
The rest I see not much problem at all.
Okay, and now we've talked about the people, and what about the goods themselves? The medical supplies, will they be getting cheaper because of the tariff being eliminated? Do we import a lot of stuff, the really heavy machines that you use for operations and all that?
Right.
So do we see that being a less obstacle to the medical industry?
Yes, you are right on that. Since the tariffs can be less, medical supplies, equipment is going to be less expensive.
Yes.
But on top of that, our company has a daughter company called N Health. They're doing all kind of procurement and lab and all logistics.
All right.
Logistics with that company going to grow very fast because they can do now. They can not only they can do in Thailand, they can always do it some other countries in ASEAN also. So I think that can be plus factors for us.
Okay. And last but not least, how do you view AEC in general? So is there more benefits than the losses for Thailand?
AEC is a dream come true. With 600 million people, AEC is a pretty girl that everybody want to court.
A pretty girl.
Right. And after looking at EU, what happened to EU now and before, I still think overall AEC is a great thing that will happen to all of our countries. At least some other part of the world will start looking at us with more importance in their eyes, which you can see that already.
Yes.
It's how we can get into that with a culture of ASEAN people and with lots of barriers. It's going to be slower, but overall, I still feel it's going to be for the goodness of all the people who live here, and we should be proud of it.
Okay, well, thank you very much, Dr. Chatree, for your share of information for today. It's very helpful, and I hope that your hospitals will gain reputation and that we should see more involvement in ASEAN.
Thank you very much. Thank you.
You're welcome.
Follow Towards 2015 every Wednesday and Thursday from 10:30 to 11 p.m. on ASEAN TV. And you can also follow us online via Facebook, only on ASEAN TV.